Welcome back to Can You Hear Me, a podcast about hearing, hearing loss, and everything in between. I'm joined today by Dr. Daniel Sun, head of neurology at the University of Cincinnati. For those of you who don't know, neurology is a subspecialty in ENT medicine that focuses on disorders of the inner ear, the auditory nerve, and balance system. Dr. Sun is a surgeon, clinician, and researcher, so he has seen the field of hearing loss from many different angles. Dr. Sun, thank you so much for taking the time to join me today.
Thanks so much, Rishi, for having me. Really looking forward to our discussion.
Of course, and I think we're going to have a great discussion today. So let's get right into it. My first question for you is, what drew you initially to the field of hearing and balance disorders, and how did that evolve into your focus on neurology and hearing loss?
Yeah, that's an interesting question. I think there's probably not one single straight answer. Like many medical students, I explore a lot of different fields in medicine, and I think each one is, fascinating for its own reasons. Ultimately, I think what attracted me to neurology is a combination of factors. On the clinical side, the surgeries that neurologists do, I found, are some of the most elegant and intricate surgeries, just because the ear anatomy is so unique for our body. And also, I think it's really an area where we can have a really positive impact for the quality of life for our patients. To this day, actually hearing is our only sense where a neuroprosthesis exists to restore that sense once it's lost. So I think it's just really interesting to think about that and to be able to work with that technology. And then on the research side, which I've always been very interested in, my background is actually in engineering, and it so happens that ENT and in particular neurology, there's just a lot of really great synergy with engineering, because so many of the questions, are best tackled through an engineering approach, and there is just constant innovation in terms of technology and the research studies and so forth.
So that was a great answer, Dr. Sun, and I really like how you mentioned that hearing is the only sense we have that can be replaced by some kind of neural prosthesis. And I think that really leads me into my next question for you, which is, what are the most common misconceptions patients have about hearing loss and treatment options like hearing aids or cochlear implants?
Yeah, that's also a great question. I think probably the biggest misconception I see is actually the amount of stigma that people attach to hearing loss, or people with hearing loss think, other people attach to their hearing loss, which is very unfortunate. A lot of people may be embarrassed by their hearing loss, or, for instance, in a social situation, if they can't hear someone say something or not understand what they heard, they may not want to admit, or ask the person to repeat themselves. And these kind of issues can really compound and result in, higher isolation than really is needed. And at the same time, I think even nowadays, a lot of people may still feel like, a hearing aid may make them seem quote unquote old, or, they may not want to have other people see that they need to wear something, on their ear to help with their hearing. I think one thing that has helped is that I think overall our society has become much more accepting of, hearing loss, as I think people have understood better and better that it's really, almost a natural consequence of just living our lives, and aging, and it's not really even a disease. It's a condition that many of us will face. And as we have more wearables, whether it's headphones or AirPods, that's also, I think, helped break down some of the perceptual barriers in terms of, wearing things on our ears, to help us communicate.
Yeah, definitely. I mean, stigma is such a huge factor that's discussed in terms of hearing loss and treatment, and that's why I chose to give it such a big part of my last couple of episodes. So that really leads me into my next question, which is how do you decide between recommending hearing aids versus cochlear implants for a patient? Does stigma play a role in this recommendation? And what are some of the challenges in that decision process?
Yeah, so hearing aids and cochlear implants are two very different things, and they are meant for, actually very different individuals. So most people, as we get older, will lose hearing to some extent. That's just how our body is programmed. It's like needing eyeglasses. And the first step is always to try hearing aids. Hearing aids are really meant for the vast majority of us who, lose some degree of hearing as we get older. For a minority, for a small, section of us, our hearing may, for one reason or another, be at a level where hearing aids no longer help. And that's really the point where cochlear implants, can be discussed as an option. So cochlear implants are never, as for individuals who still have, relatively good hearing and can benefit from a hearing aid. Cochlear implants are really for individuals with severe hearing loss, where especially the clarity of sound is just not adequate, even with the best of hearing aids.
I see. That's a good clarification. So, just out of curiosity, I know that the restrictions on who can receive a cochlear implant has slowly been loosened in the last maybe decade or couple of decades. So, is there some kind of patient population where their hearing loss, their sensorineural hearing loss, is profound but not profound enough, or they still have residual hearing that would maybe stop them from getting a cochlear implant, but also in a way that their hearing aids aren't working for them?
Yeah, that really takes us, I think, to the frontier of what we're doing right now. And you're absolutely correct. The history of cochlear implants and hearing aids is very interesting because when cochlear implants were first developed and FDA approved, it was purely meant for people who were absolutely deaf, no hearing left whatsoever. And as the technology got better and more mature, and as scientists and clinicians understood better and better, how to improve it, how to apply it, and the cochlear implants are no longer for people who are absolutely deaf. Cochlear implants is simply on the one end of the spectrum of hearing aids. And now it's much more about figuring out when someone, if their hearing aids are not doing everything they need, when are they at a point where cochlear implants may actually start working better than their hearing aids. And there's very well developed hearing tests that's specifically geared to look at whether someone may be able to hear better with a cochlear implant rather than their current hearing aids. And these hearing tests are very different from the normal hearing tests that we typically get. These are specially designed for these kind of evaluations.
I see. And your answer definitely cleared up my doubts. I mean, I know that cochlear implants are really focused on a specific group of people, but I really find these kind of frontier areas interesting because this is really where the science is being pushed, and maybe a little bit less so with single-sided deafness patients, which I believe were approved maybe 5 or 6 years ago for cochlear implants. So the actual neurological mechanics of how their body is interacting with the cochlear implant are much less understood in patients with single-sided deafness than bilateral deafness, which is my understanding. So just moving to a more kind of personal question, what is one moment in your career that reminded you why this field matters?
Yeah, that's a good question. I don't know if there's a single moment. I think I consider myself very lucky to be able to do what I love doing, and I think it's I think sometimes it's hard finding a professional role, that sort of not only fits with our personalities, but we also really feel, rewarded by, on a deeper level. And so I certainly consider myself very lucky to have, found that and to be able to do what I do. I think, to take a step back, I think, you know, as a clinician, as a physician, someone in medicine, to me, it's more about just, diagnosing a patient or doing a surgery or, putting a cochlear implant in. Oftentimes, it's the smallest moments, that give us a lot of gratitude. Maybe it's, helping someone, truly understand, their condition in a way, that, they, that they didn't understand before and have been seeking answers about, or even honestly, sometimes it's as simple as, holding the door open for someone or helping someone into a wheelchair, and because I think it really, what makes our work gratifying is, those small human connections that happen where, you can do at least something to help improve somebody else's quality of life, right? It doesn't even have to be medicine related. And, I think, those moments, constantly, I feel like sort of reinforce, the value of, of what I'm, what I am able to provide and do. And then in some of the bigger moments, it's definitely very gratifying to, see a patient back once their hearing is better and hear the wonderful stories that, they tell. And, it's just a very, gratifying connection to build.
Yeah, definitely. I completely agree with what you're saying. And I can really see how, for these patients who have lost some degree of their hearing, for you to be able to give it back to them, I can really see how that's a gratifying experience. So, just switching gears at the halfway point in our interview, I want to talk about your research. I saw that you're working on a nanoparticle based drug delivery to the inner ear. Can you explain what that technology is and why it's needed?
Yeah, yeah. So I wear a couple of different hats, and I'm actually what people call a clinician scientist, which means that I both see patients and do surgeries as well as run a research lab. And we're, very grateful for the funding we receive from the NIH and other federal agencies to be able to do what we do. And the specific, challenge that we are helping to address is actually to me, a very cool problem. And that is, the ear is actually a very difficult place to get drugs to go to where they need to go. And that's for many different reasons. And unlike other parts of the body where we already have technologies, to deliver drugs to those areas, we still face a lot of challenges in getting drugs into the ear. And one, I think to me, fascinating problem is, we actually have, some very promising potential drugs to treat very difficult problems like permanent hearing loss. But one limitation is that we just don't have a good way to get those drugs into the ear where they can work. And that's really where, my research group is working. And specifically, because of my engineering background, I collaborate with other engineers, and we are studying nanoparticles, which are very, very small, custom designed particles that have very cool features in terms of being able to be applied in a minimally invasive fashion, for instance, and being able to carry some of these promising drugs. And we hope, to be able to essentially develop some of these technologies so that future generations can use them essentially as a platform to get these drugs or even next generation drugs, into the ear to have better treatments.
Yeah, I mean, that definitely makes sense. The ear is a hard place to get these drugs into, and that's very well established kind of thing in this field. What would you say the biggest challenges are with translating this kind of research into clinical use?
Yeah, it's extremely difficult, and arduous to really, it's what we call taking something from the bench top, which is the lab, to the bedside, which is actually helping patients in the clinic. And, this is often a multi-year, 10-year, or even multi-decade process, requiring significant investment, at many different levels. And requires partnering with not just funding agencies but also industry and all the issues involved with eventually getting it approved for clinical use. And but you know my perspective is that this kind of research is not necessarily measured by whether it actually ends up, in a patient or not, right? Because, actually for our group, we're not married to the idea of using nanoparticles because research has a lot of intrinsic value for its own sake. For instance, it turns out that as we're developing these nanoparticles, yes, they have cool features that are working, but at the same time, we're actually have been discovering things about different areas of the ear that's important for drug delivery that people haven't studied. And that kind of knowledge does not need an FDA approval to be helpful because that's the kind of foundation that other scientists and even smarter scientists can use and hopefully build on and make even more discoveries and innovations. So I think to sum up the question, on the one hand, it is an arduous process that's also very rewarding. But on the other hand, there's actually a lot of interesting findings along the way that can help even before something eventually goes to market.
Yeah, you're totally right. I mean, it's very easy to think in a very closed-minded way and think that, but just because you're researching on these nanoparticle drug deliveries to the inner ear, you're only going to be looking at this stuff. But really, all sorts of factors are interacting with this, and I can really see how you would be having to consider so many different approaches and factors that can even influence your research. So I can definitely see what you're saying. Moving away from your nanoparticle drug delivery research, I wanted to ask about your opinions on future cochlear implant research. More specifically, do you think there's any specific aspects of cochlear implant design or programming that you think have the biggest opportunities for improvement?
Yeah, I think cochlear implants are a really exciting field, because it's a really cool technology that's really transformed a lot of people's lives in terms of being able to, communicate with their families, loved ones, to maintain a quality of life, as we get older. And it's also really cool because there's constant innovation going on. On the one hand, the technology itself is, fairly mature at this point, but on the other hand, there's also a lot of cool changes that's, coming on the horizon, such as implants that may be able to carry some drug with them, for instance, that can be slowly released into the ear as the patient wears the implant. And also, like you said, different programming strategies, that can hopefully make hearing even better. And maybe also understanding how our brain really uses the sound from cochlear implants, and whether there are ways to make our brain be able to use that sound even better, for instance. And there's just many different aspects, I think, in the field that's tremendously exciting, and I'm really looking forward to the innovations that's on the horizon. And then on the other end, it also takes a lot of work, to really understand what those innovations really mean at the ground level to patients. Because not every innovation may necessarily be helpful, to patients, and and that's also where our team, works is working to understand, as these innovations happen, how best to apply to them to patients, and it's not a one size fits all approach. It's which patients could benefit the most, and which patients maybe it's not needed, or even there may be side effects.
Definitely. And it's very interesting you mention the slow release drug being accompanied with the cochlear implant because I've never heard of anything like that. One other thing I've also heard of is where they're trying to make a cochlear implant that is fully in the ear. So right now we have an external and an internal part for cochlear implants, but there's some research that's trying to make it fully in the ear or just invisible. So that kind of leads me into what I wanted to ask you next. So is it, if you had to predict one breakthrough in hearing loss treatment in the next decade, what do you think we'll see? Will it be, what you've mentioned just now, or this kind of in-ear cochlear implant, or is there even something else?
Yeah, that's a good question. I think no one has a crystal ball, and it's always hard to forecast forward. I'm just knowing sort of the research that's going on, knowing the things that people are working on. I'm just tremendously sort of excited by the potential technologies that's coming down the pipeline. To me, actually, the biggest transformational change coming up is actually not cochlear implants. To me, it's actually gene therapy. Which you may have read about in some of the media reports over the past couple of years. And that's really a new frontier for our field. And right now it's only for certain kids who are born with very specific types of hearing loss. So not, really applicable to the larger population. And honestly, I don't know if it will be applicable, to a larger population within our lifetime, because there are just so many challenges associated with it when we think about the issues that we need to address in order for us to have gene therapy for age-related hearing loss, for instance. And it's something that, probably requires to some extent the drug delivery technologies that we're working on. Um, but it's just a whole new frontier, and it's just a very transformational technology for our field. To even be able to do that in these kids who are born with a genetic form of hearing loss.
Yeah, I mean, definitely gene therapy is one thing in this field I found incredibly interesting, and I'm still trying to read these research papers and understand what's going on and what they think the future directions are. And this is really something I've loved hearing about because I agree with you. I think this is definitely the biggest breakthrough we might see in the next decade. And I'm sure we can talk about gene therapy for a long time, but just to finish off today's discussion, is there anything you wish more people understood about hearing loss or hearing health?
Yeah, I think there are, I think I'll probably say two things. The first one is that, you know, our ear is a fascinating organ of our body. It's one of the only parts of our body that does not regenerate. So any hearing damage can be permanent. And it's really important that, we protect our hearing in our ears from loud noise, to use hearing protection if we think we might be around loud noise because, hearing loss can be permanent. And the second is hearing loss is also not hopeless. In fact, there's tremendous hope even when our hearing gets bad. I often tell patients who are really worried about their hearing that, today we live in an era where nobody needs to be deaf if they don't want to be. That treatments, technologies exist to help make our hearing better, if someone wants to make it better. So it's also, tremendously, I think, hopeful in terms of the things that can be done to help with hearing loss.
Yeah, definitely. And I really like how you've ended us here on a hopeful note. The concept of just hearing loss and losing one of your five senses is a really scary thing to me and to the people who have experienced it. And I'm really glad that there are people like you out there who are working to make this less and less of a reality every day. So, Dr. Sun, thank you so much again for your time today. I really enjoyed our discussion, and I think we've gone over some really great topics today.
Yeah, thanks so much, Rishi, for having me. And this has been great. And yeah, all the best wishes to you.
Thank you. Thank you.